of the places to start, my encouragement would be even looking at, and we will start this way from the 2024 highlights. You look at 50 novel drugs that were approved. Out of that, I think there were 24 that were first in class, so approximately 48% that were first in class treatments. I think another 52% of those novel drugs are for rare diseases. And so when I look at it, I think of initially some first in class treatment options. And you always have to look back before you sort of look in the rearview mirror a little bit. And that's what we're going to do in the pipeline presentation. So we're going to look at some of the key highlights from 2024. When you think of 2024, we did have Rezdiffra in a first in class for MASH. We're still going to see some activity around MASH, so that's going to be interesting to pay attention to. But there's additional first in class in hemophilia as well that are going to come in the pipeline, and so we're going to see some activity in hemophilia. We also see some activity in first in class for some brain penetrants for other conditions as well. And so when I'm paying particular attention to drugs, that's one of the things that I do is I'm focusing on what are those first in class novel treatments that provide us some of that opportunity. That's what you'll hear me discuss during the pipeline presentation. It'll also be posted. And that's really where we're spending a deeper dive into those types of drugs that are more near term. And that's an important part too, because knowing that we have this review every year, it provides us to come back to the table with new information. We're looking at the pipeline at one point in time, and that's what we're presenting. But naturally, there's going to continue to be information. There's even a handful of drugs that there may actually be approved while we're at Asembia. And so there's a couple that I'll go into for that as well in terms of their PDUFA dates. Two of them, at least, I know that their PDUFA dates are 4/29, so the day after my presentation. So it'll be very interesting to see what comes of those drugs as well.